कुठे दिसते?
तुम्हाला तुमच्या याच्यावर बाहेर दिसतंय.
अच्छा, तिथे नाही दिसत.
नाही.
वेट करतो. Can I start?
Yes.
Okay. Good afternoon. I hope each of you, your parents and neighbors are in good health. You should follow strictly instructions to use mask, wash and maintain social distancing, and you should set a good example in front of the neighbors. Today's lecture is on occupational health. It is related to workers' job. It is not only the workers in India, but all other countries. There is a lockdown, and industries and factories are closed. The economic activity becomes standstill, and all earning members are rather out of the job. Thousands of migrant daily wage earners without job gathered at railway station. On 1st of May, the countries will celebrate National Labor Day. But the condition of laborers is very bad and pathetic. But this will not last long, and there will be definitely improvement soon. So, with this introduction, we will start the lecture on occupational health. It contains introduction, definition, then the industrial health, occupational environment, occupational hazard, occupational diseases, work-related diseases, and general prevention of occupational diseases, and it is in medical measures, personal protective equipments, and environmental measures. I specifically not dealing legislative measures in this particular lecture. So, occupational medicine, it is the work in that the workforce should be economically stable. Social and economic development is associated with healthy workforce. The principal approach to ensure health and safety in the workplace contains inspection of the factories, the health education that is to be given to the workers. Those who require medical aid, they should be given the services, and there should be certain legislative things that will help for the welfare of the workers. The health services, occupational health services, not only given by doctors, nurses, sanitary engineers, safety officers, but also planners, architects, teachers, employers, industrial managers, and those who are concerned for the well-being of the society. Occupational health is a multidisciplinary activity and defined by International Labour Organization and World Health Organization as the promotion and maintenance of highest degree of physical, mental and social well-being of workers in all occupations, aiming to protect workers' health at their workplaces. So, the full or detailed definition of occupational health is promotion and maintenance of the highest degree of physical, mental, social well-being of workers in all occupation. In all occupation. The definition that is given by World Health Organization as far as the health is concerned, that definition is included in it. Then the prevention of workers from departures from health caused by their working condition. Prevention of workers of departures from health caused by the working condition, and the protection of the workers in their employment from the risk resulting from factors adverse to health, and then placing and maintenance of the workers in an occupational environment adapted to his physiological and psychological equipment. And to summarize, adaptation of work to man and of each man to his job. The definition of occupational health: promotion and maintenance of the highest degree of physical, mental and social well-being of workers in all occupations. So the first part deals with the applicability of the definition. Then the second part is the mandatory on the part of employment as far as the certain criteria that is to be fulfilled as far as the work environment is concerned. That is the mandatory on part of the employment. The third part is related to the ergonomics and definition of ergonomics. Thus, the definition is the definition of occupational health is a comprehensive, but still it is missing or lacking in one aspect. If worker contracts disease, then how he should be treated or managed, and this particular aspect is done with the ESI's Act. The second part, which is related with the obligation as far as employment should carry out, this is essential or necessary for the genesis of the Factory Act. Thus, there is occupational classification. Initially, the occupation, industrial health, industrial hygiene, and the diseases and illnesses concerned in the factories, that was included in industrial health. Then it is not restricted only in industries or factories, but also in other occupation, that is mercantile and commercial enterprises, then the forestry and agriculture and service trade, and it includes the subjects like industrial health, industrial medicine, industrial accident, industrial toxicology, industrial psychology, industrial rehabilitation, and subsequently not only the industry, but the term is encompasses all occupation, and therefore it has included occupational medicine, occupational safety, then the occupational hygiene, occupational accident, occupational diseases, and work-related diseases. Occupational disease and medicine, the subspecialty includes industrial medicine, agriculture medicine, navigation medicine, sports medicine, military medicine, aviation medicine, and all. Then what is occupational safety? Safety is the risk identification place. Preventive measures are taken to reduce or eliminate the hazards which may lead to then hygiene is the practice of assessment control of environmental factors and stresses arising in or from the workplace which may cause injury, sickness, impaired health and well-being, discomfort and inefficiency among the workers. Then the next part is the occupational environment, and you know that the environment is nothing but the sum of external conditions and which prevail at the place and which have on the health of the working population. That is the occupational environment. Environment consists of two types: domestic environment and occupational environment. Worker is working in the factory for 8 hours, 8 to 10 hours a day, and rest of the time 12 to 14 hours he is sharing the common environment which the rest of the community members are availing. And the diseases which are prevalent in the community, these diseases are seen in the workers also. On top of it, they can contract the disease due to special occupational environment where they are working. Occupational environment then divided into two: man and physical, chemical and biological agents, man and machine, man and man. There is an interaction between man and physical agents, that is the physical agents like heat, cold, humidity, air movement, heat radiation, light, noise, vibration, ionizing radiation, electricity, mechanical factors like force. So all these are the factors that are present in physical, they are considered as physical agents, and they are present in the mines, factories, textile industries and so on. There is an interaction between man and chemical agents, and the chemical agents like acid, alkali, solvent, toxic dust, metals and their compounds, all are chemicals, and chemical industries are the substantial proportion of industries, and they require for the development of human being. And the third is the man and biological agent, that is different viruses, rickettsia, bacteria, fungi, all these agents interact with worker present in the environment, and farmers, then the lab technicians, and those who are working with the animal products are exposed to it. Then man and machine, that is the another type of environment. An industry or factory implies machines driven by power with emphasis on mass production. Upgraded machine, protruding and moving parts, poor installation of machinery, lack of safety measure, long working hours, unphysiological posture are the factors that are with the machine. The man and man important environment, and here the human relationship with co-workers and authority. Psychological factors like type and rhythm of work, work stability, service condition, job satisfaction, leadership style, security, participation, degree of responsibility, trade union activity, incentive. So these are number of sub-factors which are concerned with the relationship with man and his co-workers, man and authority. In modern occupational health, the emphasis is upon people, the condition in which they live and work, their hopes and fear, their attitudes towards their job, their fellow workers and employers. Then, what are the occupational hazards? Occupational hazards are undesirable, unpleasant event or danger and risk associated with a work. A working condition or the risk that can lead to illness or death in the workplace is considered as occupational hazard. Occupational hazard means also the danger to health, limb or life that is inherent in or is associated with occupation, industry or work environment. Occupational hazards is the risk of accident and contracting occupational disease. The factors, agent or circumstances that threaten to the health of human being or that can cause harm without or with contact with these factors. So the occupational hazards can be categorized as physical hazards, chemical hazards, biological hazards, mechanical hazards, psychosocial hazards. Then there is another area that is occupational related diseases. Occupational diseases and occupational related diseases. So now we see what is meant by occupation related diseases. I told you that 10 to 14 hours of a day that worker is sharing the common or domestic environment. So whatever the health problems prevailing in the community, these problems are there in the workers also. So occupation related diseases like hypertension, peptic ulcer, chronic bronchitis, these are multifactorial diseases which may frequently be work related. They also occur among the general population. The working condition and exposure need not be the risk factor in each case of any one disease. When such diseases affect worker, they may be partially caused by adverse working condition. They may be partially caused by adverse working condition. These diseases may be aggravated, accelerated or exacerbated by workplace exposure, and they may impair working capacity. The personal characteristics like age, sex, then certain habits like smoking, alcohol, drinking of alcohol, environmental factors, that is overcrowding, and socio-cultural factors usually play a role as a risk factor. So personal characteristics, environmental factors, socio-cultural factors usually play a role as a risk factor in such diseases which I mentioned, for example peptic ulcer or chronic bronchitis, and therefore when these diseases are seen, they may be considered as a work related diseases. They are more common than occupational diseases. So the classification: behavioral and psychosomatic disorders, hypertension, coronary heart disease, peptic ulcers, chronic non-specific respiratory diseases, locomotor disorders are the occupational work. They are the work-related diseases. Occupational diseases, there is no precise definition of occupational disease, but where we can establish causal association of work environment or the job and the disease in a human being worker, then we call it as an occupational disease. Or adverse health condition in human being, the occurrence or severity of which is related to exposure to factors in the job or in work environment. Such factors can be physical, chemical, biological, psychosocial or mechanical. The occupational cause of occupational disease is overlooked by healthcare workers. There are certain characteristics of occupational diseases. The clinical and pathological presentation of most occupational diseases is identical with that of non-occupational disease. For example, asthma due to chemical like toluene diisocyanate, whatever the clinical and pathological picture is similar to that of asthma caused by say air pollution. Then the occupational disease may occur after termination of exposure. For example, asbestos, mesothelioma, cancer of lung or abdomen may be appear 30 to 40 years after that the initiation of or starting the job. Occur after termination of exposure. Occupational diseases may occur after termination of exposure. The clinical and pathological presentation of most occupational diseases is identical with that of non-occupational. Then the clinical manifestation of occupational diseases are related to dose and timing of exposure. For example, different doses and time of exposure with mercury and mercury poisoning seen in the individual. Occupational factors can act in combination with non-occupational factors. For example, exposure to asbestos alone increase the risk of lung cancer by 5-fold. But when person is also a chronic smoker, then the risk will increase 50 to 70-fold. Thus, occupational factors can act in combination with non-occupational factors, here the smoking habit. So these are certain characteristics of occupational diseases. Then these occupational diseases are grouped under there are classification, and this is one of the classification, that occupational injuries, accidents, occupational lung diseases, occupational cancers or malignancies, occupational cardiovascular diseases, disorders of reproduction, occupational dermatitis or dermatosis, psychological or mental disorders. The origin may be occupational environment. Now, the occupational diseases, we can see the diseases due to physical agent like heat, and the effect of heat is direct and indirect. Direct heat burns, heat hyperpyrexia, heat exhaustion, heat syncope, like that. Then the local effects of heat are the prickly heat. Then the indirect effect, that is decreased efficiency, increased fatigue, increased tendency for accidents. you will find that there are local hot spots like ovens, furnaces in the factories, in the foundry. Adverse effect of radiant heat. Then the glass industry, steel industry, you will find the problem of heat radiation. Textile jute industry, you will find the problem of stagnant heat, and in the mines there may be temperature as high as up to 65 degrees of degrees centigrade. And the physical work under such conditions are stressful and it impair health and efficiency of worker. There are no temperature limits given in the Factories Act, but CET 69 to 80 degrees Fahrenheit is a comfort zone, and corrective effective temperature, that is the ambient temperature, humidity, air velocity, the physical condition of a worker, his nutritional status, and the clothes he has worn, fully covered, partially covered. So all these points are considered when we talk about the corrective effective temperature or heat stress indices. And all these things are, you will be told, in meteorological environment. The second part is the cold, that is the erythrocyanosis, trench foot, frostbite, chill burns, immersion foot, general hypothermia are seen in the worker. And food processing industries or food preservation industries, worker working there are exposed to it. Or armed forces posted at high altitude are exposed to the adverse effect of heat. Then the light, poor illumination or excessive light brightness, and both will give rise to accidents and eye problem. The third is the physical factor, the noise. The heavy machinery are associated with the problem of noise. Aviation industry, soldier exposed to firing of shells and bombs are exposed to continuous or impact noise. There will be temporary or permanent threshold shift, auditory shift, and the effects are auditory and non-auditory effects, and then the intensity and frequency, that is decibel, hertz, as well as duration of exposure, individual susceptibility, all are responsible for adverse effect of noise that are seen in the individual. Noise-induced hearing loss is a notifiable and compensable disease. Then due to ultraviolet radiation, arc welding, then ionizing radiation, there are many applications of radioactive substances in medicine and industry, and radioactive isotopes, cobalt-60, phosphorus 32 are used in the medicine as well as in the hospital, as well as in the industry also. Processing of plastic, food preservation in industries, workers are exposed to ionizing radiation. And the effect of ionizing radiation are genetic changes, malformation, malignancy, leukemia, effects on the blood system, and Factory Act exposes exposure limit is set 5 rem per year. Then the pressure, Casson's disease, air embolism, blast, vibration, that is the drills and pneumatic tools like drills and hammers are concerned with the vibration, and the flying blood vessel of the heart of the pump are sensitive to the spasm, and then they give rise to vibration induced white fingers, and it is concerned as Raynaud's phenomena. And osteoarthritis of small joints, that fingers, wrists, and then elbows, shoulders are seen with adverse effect of vibration. And at the same time, worker is using one or other type of tobacco, then the effects of these vibrations are rather they are increased manifold. Then mechanical factors like injuries, accidents, again very common, and electricity burn. So these are the factors concerned with physical agent. Chemical agents, there are many industries where one or other type of chemical, like simplest chemical, rather just like a machine oil, and then benzol and benzene ring, organic chemistry, and fossil fuel and fractional distillation, right from the tar to aviation. This in the and inorganic and organic material also metals and compounds are also by local action, inhalation, local action by, and then they act as sensitizer and allergic action. Machine oil, rubber, X-ray, caustic alkalis, lime are some of the chemicals that are used in industry. Inhalation, that is the dust and fumes, and dust and they range from 0.1 microns to 3 microns are respirable dust, and they are rather present in the lung and pneumoconia. The type of mines, quarries, pottery, textile mills, wood and stone crushing industry. Workers working in these establishments are exposed to the hazards of dust. Then the gases, simple gases, asphyxiating gases, anesthetic gases, and fertilizer industries and other chemical industries, workers are exposed to these gases. Carbon is the coal manufacturing plants, steel industries, also it is present. Automobile, and then compounds, that is that again dust and fumes of various metals, manganese, mercury, phosphorus, zinc, etc. Chemical intoxication respond favorably than dust, because if worker is removed from these chemical exposure, then he will come to his normal status. But that is not case with the dust, because once pneumoconiasis is developed, then it will remain like that only. Then the third, ingestion, mercury, lead, arsen, these compounds used, and they are swallowed through food, cigarettes, and excreted through feces in small amount, and small amount may be present in. So the causing pneumoconic dust, coal dust, anthracosis, asbestos, organic bicyanosis, tobaccosis, etc., and their the count of cadmium very used in and adverse effect of the also the mines and miners. Initially in occupational history, these miners were exposed to these compounds, these compounds, and nice history is given in the occupational textbook written by Donald Hunter. Acid, pesticides are workers are, and the solvent chloroethane, chloroform you will find in pesticide, and workers are exposed to these chemicals if they are not properly trained or they are not given health education prior to starting the job. Then diseases due to biological agents, and these diseases are the brucellosis, leptospirosis, anthrax, fungal hydatidosis, fungal infections, and veterinarians, lab workers, workers involved in manufacture of immune agents, persons working with animal products like hair, wood, hide are exposed or diseases. Cancer important in black again, fumes, they show cancer, there are chemicals are used day by day, and in pre-placement examination and periodic examination, worker should be seen whether he has any adverse effect of these chemicals. Diseases due to psychological origin, that is industrial neurosis, hypertension, peptic ulcer, again seen in the worker. These psychological diseases due to psychological origin are given important, and psychological diseases arise from workers' failure to adapt to an aligned psychological environment. If worker is not in a position to adjust with his fellow workers, with management, with higher authorities, then there he is remaining constant in stress, and then this particular stress may be reflected in different ways, like frustration, lack of job satisfaction, insecurity, poor human relationship, emotional tensions are some of the things which the worker is experiencing, and then he further land into psychological diseases. Capacity to adapt to the human environment depends upon the education of the worker, daily life, culture, social habits, expectation of a worker from the management, and how he is given training prior to the appointment of the job, and continuous in-service training definitely helps to overcome the psychological problems that are seen in the worker. The psychological and behavior changes like hostility, aggressiveness, anxiety, depression, tardiness, alcoholism, drug abuse, and sickness, absenteeism. So these are the initial, relatively initial thing, behavioral changes seen in the worker if he is not tuned to the psychological environment. Psychosomatic ill health like fatigue, headache, pain in shoulders, neck, back, then propensity to peptic ulcer, hypertension, heart diseases, rapid aging. So these are the psychological diseases. Sometimes maybe there may be difficult to demarcate whether it is the occupational disease or work-related disease. The increasing stress due to automation, electronic operation, nuclear energy, and more and newer technologies in the industry, and not cope up with these newer technology, then he will constantly remain under tension, and then the psychological disorders will be seen in him. Now, so up till now, just the occupational hazards, occupational diseases, and I have and occupational related diseases I have enumerated and discussed. Now, what are the general measures of prevention and control of occupational diseases? Again, it is the whatever the diseases that are seen in the community, whatever the approach we are adopting to overcome the problem of diseases in the community, the similar approach is to be adopted even for the occupational diseases. The workers are the part of the community, and the community medicine, community health, and the occupational medicine, occupational health, these are rather similar thing, but part of the community health, special community health in relation with the occupation and workers, then it will be the occupational health. So medical measure, the levels of prevention: primary prevention, secondary prevention, tertiary prevention. Mode of interventions are health promotion, specific protection, early diagnosis and treatment, disability limitation, rehabilitation. So in this way one can overcome the problem of occupational diseases. Also, history of disease, now COVID, healthcare workers. We don't have a history, natural history of this disease. The data is gathered, and what we have, the experts are rather in and the period of pathogenesis, natural history of a disease, and at the bottom level, in this particular diagram, level of prevention and modes of intervention. So general measures, we can say medical measures, personal protective, engineering measures. Legislative measures we will discuss next in next lecture. So medical measure, pre-placement examination, meaning by placing the workers prior to the job, and for this the doctor, industrial physician know the requirement of the job requirement. He should thoroughly, and then he should whatever the that he examine their medical history, clinical history, past history, then occupational history, thorough clinical examination, and various lab tests, blood tests, liver function tests, kidney tests, renal function tests, all tests, as well as liver function test, blood examination, all these things should be carried out, and that will be the benchmark, that is the basic record of a worker. It will act as a benchmark, and then worker may be totally rejected, or according to his ability a particular job is given to him. Anemia, hypertension, nephritis is worker is suffering from this, then he should not be given a job where lead is hazardous, in the periodical medical examination, that is due to occupational exposure, the effects of occupational exposure need not be seen immediately. They are gradually seen in the workers, and therefore periodic medical examinations are to be conducted yearly, monthly, or even daily, depending upon the type of occupation, type of hazard, the existentiveness of the hazard, that will give rise to the content as well as the frequency of duration or frequency of the medical examination. Medical and healthcare services, meaning by the worker should be given the job services when he is having the disease, and industrial physician Industrial physician should be given the medical, give the first aid or treatment as and when required. Notification of diseases, Factories Act gives 20 diseases, Mines Act 3 diseases, Doctor Worker Regulation tells 8 diseases which are notifiable, and these are internationally notifiable. They are internationally notifiable diseases and compensable diseases. Maintenance and analysis of the record should be maintained, and they should be analyzed intelligently, so that will be helpful for assessment of the health status of a worker, whether it is deviated from what is at a baseline or it is remained as same. Health education and counseling health education should start prior to the appointment of the job, and health education about the hazards that are associated with the industry, with the job. Then health education as far as using the personal protective equipment, why and when and how these equipment should be used. Health education and counseling. So the medical measures are pre-placement examination, periodic examination, medical and health care services, notification of diseases, supervision of working environment, maintenance and analysis of record, health education and counseling. Then the personal protective equipment like earplugs, ear muffs, helmets, safety shoes, aprons, gloves, gumboots, barrier creams, goggles. These are the various personal protective equipment, and depending upon the type of exposure, appropriate personal protective devices should be used by the worker. Now, personal protective devices for healthcare workers, as far as the COVID-19 is concerned, you are well aware of it. And these personal protective devices, like directly those who are directly coming in contact with patients COVID-19, they should have the full apron, then the N95 mask, then the face mask and full gloves, hand gloves and foot covers. So all these you know very well. Then the respirators are also two types of respirator depending upon the dust and gases that are present in the breathing zone of a worker. Appropriate type of respirator must be used, and these are two types: those which remove contaminants from the air and those which give fresh air supply. So personal protective devices should be used only during the emergency. All these personal protective devices are in our museum, and you are supposed to see and also try to use these personal protective devices, and then you can realize that there are also some problems while worker is using these personal protective devices. As far as the movement is concerned, sensation is concerned, weight of personal protective devices and so on. And then the third measure of prevention and control of occupational diseases, that are the engineering measures. And in engineering measure, design of a building, good housekeeping, general ventilation, mechanization, substitution, dust, enclosure, isolation, local exhaust ventilation, statistical monitoring, environmental monitoring and research. These are the things concerned with the environment. Design of a building, it starts start from the blueprint of the factory, and the type of floor, walls, height, ceiling, roofs, doors, windows, cubic space per person, and industrial architects can build the industry with this particular, taking into consideration what is laid down in Factories Act and different legal provisions in relation with that particular industry or factory. So it starts from prevention of diseases, start from designing of the building. Then good housekeeping. The term that is used in industry is meant, whatever we say, a good housekeeping in the house. The general cleanliness, ventilation, lighting, washing facilities, food arrangement, and general maintenance all include in good housekeeping. Then it is the fundamental requirement of control and elimination of occupational hazard, and also it raises the morale of workers, and it increases efficiency of worker, it increases productivity. Also in good housekeeping, whitewash, then vacuum cleaners, then as far as the dust is very common thing in the environment, occupational environment. It settles down on floor, ledges, beams, machinery, stationary object, and again if that particular process of grinding, polishing, grinding, then naturally they are exposed to this dust and pneumoconiosis. So this dust control is very important. Personal protective equipment should be kept in a good condition, and right thing should be in the right place. That is the essence of good housekeeping. General ventilation, 5 square feet per worker air should be supplied to the worker, and efficient exhaust ventilation system must be there, and 500 cubic feet of air per person, that is spelled out in the Factories Act. Mechanization, there should be avoid direct contact with harmful substances, and mechanical devices should be used for mixing of chemicals. Then the acid should be conveyed through pipes, and there should be little hand operation. Then substitution, hazardous material should be substituted by less hazardous material. The white phosphorus should be substituted by phosphorus sesquisulfide. And the phossy jaw, macho workers, that was seen in previously. Now the phosphorus is changed in this match making industry, and the problem of phossy jaw malignancy, that is overcome. The lead paints should be substituted by zinc paint, mercury salts by silver salts, and so on. Then the dust control can be done by water sprays, weight drilling of rock, adding of moisture during grinding, sieving, mixing. Then enclosure with exhaust ventilation to prevent exposure of a dust and fume. Again, respiratory, bronchitis, and then for pretty long time leads to malignancy, pneumoconiosis, and even malignancy. So enclosure with exhaust ventilation. Isolation, offensive processes, offensive things should be in a separate building. Isolation in terms of space, isolation in terms of time. As far as healthcare worker and general patients and the present COVID-19, we have isolation hospital outside the particular premises of Pravra Medical Institute. And then isolation in terms of space and time. Certain hazardous processes are rather carried out during the night. Local exhaust ventilation, dust fumes can be trapped and extracted at source, and before they escape in atmosphere by suction into hood and are conveyed through ducts into collecting units, and breathing zone is kept free. Then environmental monitoring, statistical monitoring and research are other things concerned with the engineering measures of occupation. Just we will discuss next time. Wish you a good health ahead. Thank you.
ते मध्ये हे का असं करत? YouTube कनेक्शन नाही.
सर नेहमी तुम्हाला मी लेट करतो.